According to the World Health Organization, South Africa rates high among countries battling the Foetal Alcohol Spectrum Disorder. A study shows that South Africa accounts for about 290 cases per 1,000 births of the disorder. One NGO is of the view that government can do more to save thousands of lives from this condition. And for more on this, we are now joined by Nicklaus Bauer, the campaign manager of Alcohol Harms Reduction. Nicklaus, thank you so much for joining us this evening. Now, South Africa has rated the highest with fetal alcohol spectrum disorder. What are the contributing factors to this?
Well, good evening, and good evening to the viewers as well. Thank you very much for the opportunity. The DG Murray Trust's Alcohol Harms Reduction Program has long advocated for the fact that South African laws simply don't control the flow of alcohol, the flow of cheap alcohol in South Africa, and unfortunately it has led to not only the subject that we're speaking about this evening, fetal alcohol syndrome, but indeed, unfortunately, heavy and binge drinking. The fact of the matter is, internationally speaking, if you look at South Africa in comparison to other even developed nations, we have fairly freely available alcohol that is cheap by international standards and is not controlled to, at least our mind, the requisite level to ensure that it's not abused.
Do you think there's enough education, especially for expecting moms? I mean, in the past, with our history, we know that the dope system was one that led to a lot of women drinking during pregnancy. I don't know if this generation is still subjected to such, but do we have enough education educating expecting moms about the harms that this causes to the unborn child?
Well, let's look at the facts. I mean, there's no national action plan when it comes to dealing with fetal alcohol syndrome, which is quite startling when you look at the numbers. I mean, you've mentioned it yourself. The World Health Organization is pretty plain about the fact that South Africa's got the highest recorded level of fetal alcohol syndrome disorder in the world. And we certainly are hoping that from a national point of view, we try and take this a little bit more seriously. The Department of Social Development has, of course, acknowledged this problem. International Day marking fetal alcohol syndrome in September last year was noted, and the fact that we have such a persistent problem with this issue was, of course, taken into account by the government. But in terms of steadfast action, we're only really seeing a concerted effort from a legislative and government point of view in the Western Cape, it being one of the provinces with the highest prevalence. When you look at South Africa, each province individually, Western Cape being the most predominant. Of course, you alluded to the DORP system that is part of our painful and divided history. But indeed, other provinces as well, like KwaZulu-Natal and the Northern Cape, also showing high levels of fetal alcohol syndrome, unfortunately. And certainly there needs to be not only an education of what alcohol can do to your unborn fetus when you are an expectant mother, but indeed as well support needs to be given to expectant mothers that are in a situation that would lead to them turning to substance abuse because that is their way of trying to deal with the situation itself.
So, Nicklaus, I mean, what would we need to do for there to be a specific national policy that addresses the prevention of such heavy drinking in this country?
Well, it's not like we don't have legislation on the table. This is the most frustrating part for us, really, is that there is legislation that is currently being looked at. You look at the Liquor Amendment Bill of 2017. I mean, that's essentially been on hold now for over 5 years. And that would significantly curtail the illicit flow of alcohol, at least also tighten up controls in terms of how it is advertised, how it's portrayed. And for us to take this seriously as South Africans, it's not a question of it being a necessity solely for advocacy groups like ourselves. I mean, you just look at it from an economic point of view. There's a study that was done in 2014 that showed that heavy and binge drinking in South Africa costs up to 277 billion rand a year in just health-related costs. Now, if you adjust that with inflation to 2022, that's 433 billion rand. So it's certainly high time. I mean, not only from not even a moral point of view, just a simple economic point of view, to try and take the scourge of heavy and binge drinking more seriously in South Africa. And please, let's also not distort the message here. The DG Murray Trust and indeed the Alcohol Harms Reduction Program is not against drinking per se. South Africa as a whole doesn't have a problem with alcohol. We've got a problem with heavy and binge drinking. Only a third of South Africans consume alcohol, but a half of that third, some 15% of the population, they consume at such a heavy rate that we've got the 5th highest consumption rate in the world. And that is, unfortunately, it's a real problem that we have to deal with. And it's not only about government as well. I mean, private sector also needs to play its role. Civil society is certainly playing its role. There's a lot of good work being done by NGOs across the length and breadth of South Africa to educate our population, to provide the support where it's needed. But without the implementation of legislation like the 2017 Liquor Amendment Bill, along with others, we're going to be stuck in the mud on this issue for a very long time.
I mean, Nicklaus, you make mention of a third of SA's population consuming alcohol, and more than half of that are defined as binge drinkers. Maybe some people aren't even aware that they binge drink. How would you define a binge drinker?
An extremely important definition that we need to get to, because let's also accept the fact that to a large extent, socializing in South Africa is often punctuated by the consumption of alcohol. Some people might be listening to this conversation and say, well, he's a massive spoil sport, isn't he? He doesn't want me to have any, he doesn't want me to have any beers with my braai, and it's a Friday night nogal. Well, I'm not saying that. Drink and drink in moderation, but don't binge drink. Binge drinking means 5 drinks or more in one sitting. So if you think about it, if you're maybe going out and what do the young kids call it nowadays? Go chill in the club, and you have more than 5 drinks in one sitting, then that is classified as binge drinking. And if you look at what that does from solely a physiological point of view, the pressure that puts on your body and your system itself to try and deal with that amount of alcohol over just a period of several hours is extremely damaging. And that's just one episode of drinking. And if we look at the places where there is heavy and episodic drinking in South Africa, it's normally the parts of the country where there is a high prevalence of socioeconomic issues, other very, very difficult societal issues that these communities will be dealing with, poverty, inequality, a lack of housing, a lack of employment, and it all feeds into each other, really. And South Africa has enough problems to deal with, really, than to add heavy and binge drinking on top of it. Alcoholism is a real disease in South African society. We need a pragmatic approach, not only to deal with it from a health point of view, but also from a legislative point of view. As I mentioned earlier, it's a socioeconomic disaster that's brewing every single day, pardon the pun, in South Africa.
Now, Nicklaus, I mean, earlier on you made mention of the access to alcohol. I mean, the alcohol prices being very accessible to people, but we know that the Minister of Finance every year increases the sin tax around alcohol and cigarettes. How is it that South Africans are still able to afford so much alcohol in the midst of so much that we still, in terms of increases in rates, and how much money is accessible within the market for us to be able to even purchase this amount of alcohol?
Well, studies have also shown that even in societies where there is an economic crunch, the consumption of alcohol will continue unabated regardless, of what the price may be, certainly on varying levels. But from a South African perspective, let's just look at the facts, right? I don't know when last you bought a quart of beer, but you compare that to a loaf of brown or white bread, and the beer is cheaper, unfortunately, than the loaf of bread. This is not normal. And you may well think that sin taxes that are indeed a fixture of the budget every single year would prevent behavior in this way. And it may well do to a certain extent, but if we look at overall consumption patterns, it's not doing enough in terms of curtailing heavy and binge drinking. That's really just fueled by cheap and readily available alcohol. Let's look at the readily available point, all right? Now, various breweries and indeed alcohol companies in South Africa they've also played their part in terms of ensuring that the people that they're selling to, the organizations, the companies that they're selling to at a wholesale level, whether or not it's taverns or bottle stores, they always make sure that it is indeed well licensed and it's all legit. Organizations and companies that can go on and sell alcohol. But when they're selling it at a wholesale rate, that beer or that alcohol, I should say, overall, not just beer, does find itself into illicit establishments and establishments that are operating in communities where there's little or no control, and there will be a high prevalence of illicit sales of alcohol. Now let's look at the price for a second. I mean, I already mentioned that a quart of beer is cheaper than a loaf of bread in South Africa. There is a study that was 2018 by Deutsche Bank that illustrated that South Africa, one of our two biggest cities, Johannesburg and Cape Town, has among the cheapest beer in the world. And if we look at other places in the world where there was a high prevalence of alcohol abuse, simply introducing things like minimum unit pricing, right, which bakes into the price of an alcoholic beverage a certain level of tax based on the overall alcohol content in that beverage. That leads to the curtailing of heavy and binge drinking. And the easiest example for that is Russia. During the 90s and the early 2000s, Russia really had near lethal levels of consumption of vodka. And when they introduced minimum unit pricing, that was severely diminished. So there are various levers that the government can look into in trying to implement to curtail heavy and binge drinking in South Africa. But certainly here at the DG Murray Trust, the Alcohol Harms Reduction Program, we're advocating for a partnership approach between not only government but indeed the private sector and civil society, because it's one thing controlling it from a cost point of view, but certainly people that have become hooked on alcohol, for instance, and abuse it regularly are going to need to fall back on treatment to ensure that they know what is out there. And if we're going to be tackling things like the topic of our discussion this evening, fetal alcohol syndrome, we're going to need a national action plan, and we're going to need all social partners on board to try and tackle it. Where on earth do you have something where we have the worst levels of fetal alcohol syndrome in the world, and yet we're not tackling it from a national standpoint? There is an acknowledgement from government, and we applaud them in that regard, but there needs to be more action. There needs to be a national plan that is implementable, that is not just put down on paper, that is actually practical, fit for purpose, and goes a long way to addressing fetal alcohol syndrome in South Africa.
Nicklaus, and speaking about tackling it from the root cause, I mean, what we are seeing now is that a lot of young mothers and young women who work hard are often also still studying in school and have to juggle between work and home. We're seeing the wine mommy culture also brewing. How toxic is that becoming among South Africans?
Well, again, I mean, we spoke a little bit earlier about the fact that this is hard baked into our culture. Whether or not it's, whatever culture, whatever background that you come from, I would struggle to find one demographic group in South Africa that doesn't, as part of their socializing, have the enjoyment of alcohol at some point in time, whether or not it's traditional beer, whether or not it's champagne, whether or not it is mulled wine. It's become part of South Africanisms, if you will, and it has to a certain extent become not only part of our culture, but accepted to a certain point of view. But with this in mind, with all of the alcohol advertising that would also promote this type of behavior, not only the enjoyment of a drink, but certainly enjoying it responsibly, but leading to unfortunate abuse of alcohol, it needs to be, at the same time, the same sort of spotlight needs to be shone on the adverse effects of alcohol, and indeed how and when people can access that help when they need it. Certainly one of the things that we're advocating for at the Alcohol Harms Reduction Program is to ensure that when a person thinks that they may have a problem, they're able to understand that help is not that far away. There is a myriad of opportunities in the public and private sector for people to access counseling, to access rehabilitation as well. I understand that very often finances may well be a challenge for people that want to seek help, but there is government-sponsored, government-supported institutions and organizations that will be able to help. There's never, ever no time to ask for help. It's never too late. And certainly if you're watching this right now and you may think that you do have a problem with binge drinking or heavy drinking or have a problem with alcoholism, you need to reach out to organizations like Alcoholics Anonymous. You can also check out the DGMT website, dgmt.co.za, alcohol harms reduction page. Goes a long way to explaining what's out there and what's available for people to ensure that they know that they're not in this alone.
Most certainly. Nicklaus, thank you so much for joining us this evening. We really appreciate your time. That was Alcohol Harms Reduction Campaign Manager Nicklaus Bauer.